Hi, Dr. Rivera. This is Dan Waterman with my submission for the low back evaluation and treatment algorithms and my comfort level with them. So what's interesting is that I do work in a chiropractic office. So the perception that I am moderately uh, aware of low back categories and treatments and assessments is fairly accurate. So I've been working at the chiropractic office for 4.5 years, and that first year was really challenging for me because I was very similar to to the other students in the program and other athletic trainers in that low back pain was something that I just often referred out for because I was not comfortable evaluating and treating that. So what was kind of interesting is now my comfort level with it is fairly high. I'm pretty comfortable and confident in evaluating patients, screening patients for more catastrophic injuries and accurately being able to assess a spondylolisthesis or a quadratus lumborum strain or disc or facet irritation in a way that I really haven't been before. So what's the other perception is that I'm really, really good at evaluating low back patients, and I'm actually not. I still consider myself fairly novice. I would call myself an advanced novice in this area, specifically the evaluation portion, because I do rely on the chiropractic doctors that I work with to diagnose because they have a lot more experience and education in those parameters. So I rely a lot on their evaluations. With that being said, after working there for 4.5 years, seeing similar presentations of patients and their diagnoses through the chiropractic doctors, I've accumulated enough information to be able to accurately be able to assess and observe and evaluate and more accurately diagnose those injuries and pathologies. For treatment, I feel like that's really my strong suit is and that's where I found the TBCs for the treatment-based categories about a year and a half, probably closer to 2 years ago now. And so I'm using that as my evaluative tool as well. So in that first treatment or that first evaluation, I'm going through a lot of those. Does it centralize? Is it a peripheral issue? And is it increasing pain, decreasing their pain or symptomatology? And if it's decreasing their symptomatology, then we know that we want to get them into those ranges of motion. And so I give them those exercises. And then we avoid the exercises that create the irritation, very similar to every other body part. One thing that I have been doing that is I do a lot of stabilization in my programs is even with a hypomobile joint, I am still continuing to do stabilization exercises, trying to get oblique engagement. But a lot of the times, my oblique engagement comes with rotational stability. So I guess my stabilization exercises are a lot different than you would for like a plank or something along those lines. So overall, I think I'm fairly confident in low back and hip and sacrum evaluations. And I continue to read research and digest and synthesize that information. And this section has certainly helped with those parameters.